Hi, my name is Tom Schultz. I'm the founder and CEO of Divine Inspirations. My company has developed a new disruptive software technology that we believe will revolutionize many industries. The first application of this technology has been packaged in a healthcare web application called GoogleRx. This video will demonstrate use of GoogleRx as a powerful tool to ask and answer compelling healthcare questions, enabling unprecedented management of healthcare costs by healthcare payers and population health managers. Managing healthcare costs today is done at a low level of granularity. For example, examining drug alternatives or medical procedures for the treatment of a medical condition. What is very difficult to do today is management at a higher level of abstraction. This is akin to seeing the trees in the forest, but missing the forest. Instead of simply asking how much money was spent on a specific drug like prednisone, imagine being able to ask how much money was spent on a class of drugs, such as steroids or opiates. Imagine asking how much money was spent on a disease like diabetes, or a class of diseases, such as autoimmune diseases. Or imagine asking how much money was spent on a body part, like the pancreas, or a group of organs, like the endocrine system. Imagine being able to rank order these higher level classifications of drugs, diseases, or body organs in order to gain a deeper understanding of where to put your effort in reducing costs. These are some of the capabilities offered by GoogleRx. The following demonstration makes a case for this bold claim.
GoogleRx looks similar to Google. You type in health-related search criteria and then press carriage return or the Execute Rx search button to execute the corresponding query. For the purpose of this demonstration, we will use the theme of managing diabetes. GoogleRx can be used to explore drug treatment options by typing the following: drugs treating diabetes. We see 458 rows returned of various drugs. We have a column labeled harm reported. This is the number of drug harm claims filed with the FDA for each of the drugs shown. We have a column labeled harm validated, which has legal values of Y for yes and N for no. This represents whether or not the medical community is aware of any harmful side effects for each of the drugs. The output of GoogleRx can be sorted by clicking on any column header. Let's click on Harm Reported. This reveals that citalopram has the most number of side effects reported to the FDA. And let's drill down and look at the FDA data. Let's sort on the count column. This tells us that drug abuse is the most reported side effect of citalopram. A little bit surprising because citalopram is an antidepressant. Let's go back to the previous GoogleRx page. And let's now click on the Y in the harm validated column. And this tells us the number of adverse events the medical community is aware of with regard to citalopram. Factoring in the number of reported side effects and side effects known by the medical community can be an important consideration for a healthcare payer when recommending drug alternatives. Let's use GoogleRx to examine the amount of money spent by the government last year on drugs to treat diabetes. The complete answer to this question is a bit more complex. To get a full picture of the total cost, you need to factor in the cost of the drugs that cause diabetes, plus the cost of the drugs to treat diabetes, plus the cost of the drugs used to treat the side effects caused by the drugs to treat diabetes. Determining the drugs causing diabetes can be found by typing the following: drug causing diabetes. We see a number of drugs listed here, 4,226 rows. To derive the amount of money spent by the government on drugs causing diabetes, we add the following. 2014 government cost associated with drugs causing diabetes. The output shows a column of drug names. We also see a column with a header labeled drug cost. This represents the number of dollars spent last year by the government on each corresponding drug. We also see a column labeled total criteria cost. In this case, the criteria are drugs causing diabetes. So the total amount spent was over $5 billion. We also see a column labeled total drug cost. This represents the total number of dollars spent by the government across all drugs last year. To calculate the 2014 government cost associated with drugs treating diabetes, we make the simple modification. We change causing to treating. And we see 359 rows returned. Let's sort on the drug cost column. This tells us that the government spent the most amount of money last year on insulin to treat diabetes. To derive the cost of the drugs treating diabetes drug side effects, we can make the following modification. Cost associated with drugs treating disorders caused by drugs treating diabetes. And we see 432 rows returned. If we wanted to, we could continue this process and derive the cost of the drugs treating the side effects of side effects. GoogleRx can be used to explore high-level disease classifications. To explore disease classifications associated with diabetes, we can type in the following. Diabetes disorder classifications. And let's scroll through the list. In scrolling through the list, we discover that diabetes is an endocrine disorder. Let's go back and ask how much the government spent last year on endocrine disorders. We can do that as follows. 2014 government cost associated with drugs treating endocrine disorders. And here are the results. Besides drugs, let's explore other potential expenses associated with endocrine diseases. Consider the following. Lab tests associated with endocrine disorders. And we see the following. To explore procedures associated with endocrine disorders, we can make the following modification. We simply changed lab tests to procedures. And here are the results. 6,051 rows returned. Let's go back to talking about diabetes. GoogleRx can be used to explore body organs affected by diabetes. This can be accomplished by typing in the following. Organs affected by diabetes. In looking through the list, we see a number of body structures. We see kidney structure. Let's now go back and ask about drugs affecting the kidney. We can do that as follows. Drugs affecting the kidney. And we see many rows returned from this query. Let's now go back and ask, how much did the government spend on drugs affecting the kidney? We can do that as follows. 2014 government cost associated with drugs affecting the kidney. And we see 4,027 rows returned. Let's now examine different lab tests associated with the kidney. We can type the following: lab tests associated with the kidney, and we see 73 rows returned. Let's examine procedures associated with the kidney. We can make the following modification. We changed lab tests to procedures, and we see 4,234 rows returned.
You have just witnessed a powerful demonstration of using GoogleRx to calculate the total amount of money spent by the federal government last year on drugs causing or treating a particular disease, class of diseases, body organ, or body system. If you are a healthcare payer, such as an insurance company, you will have your own drug cost data, plus other costs, such as cost of lab tests, medical devices, clinical procedures, etc. By including these other costs, use of GoogleRx enables you to calculate the total overall cost of a particular disease, class of diseases, body organ, or an entire body system. Given the ability to perform a cost analysis of a population in terms of drugs, diseases, and body part conditions, let's examine how GoogleRx can be used to track down people in a population having those conditions.
Let's use GoogleRx to actually find patients in a hospital network having endocrine disorders. This part of the demonstration uses fabricated patient data representing electronic healthcare record information hypothetically extracted from Aurora Healthcare, a network of 17 hospitals in Wisconsin and northern Illinois. Consider the following: Aurora hospitals with patients having endocrine disorders. What is returned is the following: a number of Aurora Healthcare hospitals having a number of different patients, and these patients having various diagnoses that are classified as endocrine disorders. GoogleRx can be used to find patients taking a particular class of drugs. Consider the following example: Aurora hospitals in southern Wisconsin with patients taking opiate drugs. What we see are a number of Aurora Healthcare hospitals having various patients who in fact are taking a number of drugs that can be classified as opiate drugs. Instead of a patient population limited to Aurora hospitals, GoogleRx has the ability to query theoretically across all healthcare institutions in the United States. Now, in this demonstration, GoogleRx is emulating this using a collection of databases running on various servers. Let's consider the following example of what a query across the U.S. might look like. Hospitals with patients having chronic diseases. Notice that patient data from a fictitious healthcare information exchange shows up. What is interesting about this is the fact that the underlying data for this HIE came from various XML documents, a CCD XML document, and some prescription drug XML document. GoogleRx uses Divine Inspiration's TCSQL technology that knows how to query the data in any XML document without having to know anything about the XML document, including its structure. If you're an IT person, Such a claim should sound impossible. TCSQL uses a knowledge modeling concept called soft schemas and a revolutionary concept called polymorphic queries to accomplish this.
You have just witnessed a demonstration of GoogleRx. The examples illustrate the use of GoogleRx by an average person to perform powerful search and compute capabilities in seconds or minutes. What normally could take weeks or months to achieve by a team of highly skilled technical professionals. GoogleRx represents the first of a revolutionary new breed of applications supporting a disruptive new knowledge inference search and compute paradigm created by Divine Inspirations. The demonstration version of GoogleRx you witnessed utilized a small set of reported drug harm data from the FDA, drug cost data from CMS's Medicaid drug rebate program, and fabricated data representing fictitious patient data from Aurora hospitals. The Healthcare Knowledge Base UMLS from the National Library of Medicine was used to classify this underlying data. The powerful knowledge inference search and compute capabilities demonstrated utilized a software technology called TCSQL from Divine Inspirations. The production version of GoogleRx will be readily available in the fall of 2015. Use of GoogleRx to the general public will be free of charge. If you are a healthcare provider, a healthcare payer, population health manager, clinical researcher, medical coder, or a law firm, and you wish to become a customer of GoogleRx, please contact me as follows. I hope you enjoyed watching this demonstration, and thank you for your time.